Hi, everybody. A little bit of a different topic today. Someone posted a question on one of my other videos asking about any advice or what kind of support should be considered for folks who have recovered from hand, foot, and mouth disease. So, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. In my clinical practice, and quite frankly, in my personal life, because one of my kids had hand, foot, and mouth before. The I don't really worry too much about post-treatment of hand, foot, and mouth. In contrast to someone, say, had Lyme disease, and even if they've fully recovered, if they're a patient in my practice, I would virtually always recommend some post-Lyme treatment just to be on the safe side, because we know that Lyme can come back to wreak havoc on a person's system if it's not really comprehensively treated in the first place. Something like hand, foot, and mouth, though, I'm not really concerned about that. Ultimately, the virus that causes hand, foot, and mouth can sometimes cause issues if a person becomes immunocompromised due to, say, mold toxicity, or they have some other infection that they pick up, or there's some other reason that their immune system becomes compromised. We can certainly see these viral reactivations happening, but sort of in the here and now, I wouldn't really be. I'm not personally concerned about post-treatment of something like hand, foot, and mouth. With all that being said, just a little general thought about hand, foot, and mouth in general. I think about hand, foot, and mouth treatment support the same way that I think about any acute viral issue. So whether it's a cold, a flu, hand, foot, and mouth, what have you, shingles outbreak, like any type of acute virus, I would generally use the same types of support. So, making sure we have a robust amount of vitamin D, depending on the patient, depending on the scenario, depending on their age, what they can, tolerate, like in terms of like swallowing pills or taking things that taste gross. With kids, it's a lot harder to get things down the hatch. Thankfully, there are certain formulas that are easier to get down the hatch than others for kids, but using antiviral herbs, thinking about vitamin A, vitamin C, things to that effect. Also, I really like essential oils when it comes to treating viral infections. For my kids, they're not old enough, my little kids anyways, are not old enough to swallow pills, but we will rub either straight or diluted essential oil into the soles of their feet. Now, if they had hand, foot, and mouth, and they had lesions on the bottom of their foot, I wouldn't put essential oils on them in that case, but could be rubbed into the forearm or the belly or something like that, and there'll be some degree of systemic absorption that way. Also, I'm a big fan of using silver hydrosol spray. Silver hydrosol is distinct from colloidal silver. They both have silver in them, just silver hydrosol is an aqueous solution which won't bioaccumulate. Colloidal silver is a salt which can potentially accumulate and, in extreme cases, cause agiria, which is well, if you've ever seen, Google agiria if you don't know what that is, and you'll see people that look blue. It's pretty crazy. But silver in a hydrosol form, very safe in my opinion, and that's something that can be fairly easily administered to kids because it doesn't really have a taste to it. It can be sprayed topically on areas that are affected, and it's something that is a handy tool to have in the tool bag in my clinical practice, at least. So just a little plug for general antiviral supports when someone's dealing with a virus. So I hope that this information was useful to the person asking the question. I hope other folks listening found this information useful or of interest. If anybody has any questions about this topic or anything else, just post it in the comment section below, and I'll do my best to answer as soon as I can.